So in this video today, we're going to go through 5 exercises to help with frozen shoulder. Now, in other videos, make sure you check those out. We talked about the different things that could mimic a frozen shoulder, and that happens a lot in our office where people think that it's a frozen shoulder. The doctors say it's a frozen shoulder. They come into our office and we're like, this is not a frozen shoulder. This is coming from your neck, or this is coming from your thoracic spine, or this is coming from your shoulder, but it's more of a shoulder derangement. It's not necessarily a frozen shoulder. So if you want to learn more about that, make sure you check out that video, and we're going to be making others talking about what it looks like when other things mimic a frozen shoulder. But for this video, we're going to go into the treatments that we give our patients when they get the diagnosis of frozen shoulder, things that they can do at home that'll help assist them with what we're doing up at our office. Hi, my name is Stephanie. I am the owner of Empower Physical Therapy, and we help clients avoid surgery, injections, and medications while getting their life back. We put the pieces of the puzzle together. Often in our healthcare system, we tend to treat the symptom. We go to the side of the pain, but in reality, we always tell clients where the side of the pain is often not where the source of the problem is coming from, and you've got to find someone that can really put everything together. So if you want other videos that we talk about on the frozen shoulder, make sure you check in the description as we put other videos in there on this topic. So let's get into 5 exercises that you can do to help with frozen shoulder. And so 3 of them are going to be more joint related, and 2 of them are going to be more like working on just trying to get the motion back. Now with frozen shoulder, we talked about in other videos, rotation is very limited. So like external rotation is really hard when your arm goes back like this. Usually can't even do it. Internal rotation is pretty hard, not as hard as external. We'll have issues with going out to the side. And the easiest motion usually is going up. So with a frozen shoulder, we like to, because the capsule around the joint gets tight, we like to stretch the joint so that we can, if this is the capsule and it's tight, we want to do things that kind of stretch the joint so we can start getting a little bit more motion back in there. And if we can improve the motion in that joint, then that's going to translate to improved motion with your range of motion. And the more that we can move it, the less pain that we will start to have as that joint is starting to kind of thaw out, as we say, from a frozen shoulder. So the first exercise, we're going to go into the joint. You're going to lie on your stomach, and you're just going to prop up where your elbows are up, right up in line with the shoulder, like through there. And what we're going to do is you're just going to sink down. You're going to sink those shoulders. So those shoulders are going straight up, trying to improve that mobility in the joint. So you'll just kind of hang out here and just stretch it, sinking down. Usually this one's fairly easy for most people to do. The next one that I'll show you is a lot more difficult, and sometimes people can't do that one. But this is a good one. You're just kind of just getting that shoulder joint to kind of stretch so that you're just kind of hanging out there in that position, trying to, again, improve that flexibility within that joint capsule. So you'll hang out here for a minute or 2, do it a minute, and come back to another minute. Do this, every 2 to 3 hours type thing, just so that we can kind of open up that joint a little bit more. Because again, the more that joint moves, the more that your function will start to improve. So the next one that we're going to do, we're going to go in the opposite direction. Now this one typically can be a lot harder because sometimes people just don't have a lot of motion going back like this. So again, we're going to be kind of on our elbows. We can make things easier by the further back you go. You may not be able to do this. You may have to bring the elbows closer in and then just kind of, again, sinking down. So you're sinking down, trying to stretch the joint in the opposite direction of where we just were. If we can come back here, this is going to be a lot better. You can change the motion of it and different angles to stretch the joint by moving your elbows forward or backwards. Going the further back is going to be much harder to do. Some people can't even tolerate this at the very beginning. Some people can't even tolerate this exercise at the very beginning, but you can slide the arms in a little bit more, and this will be a little bit easier to do, and sliding them back is going to be a little bit more difficult. So again, you're going to kind of hang out here for about a minute, a couple times. Do it every 2 to 3 hours, just again, kind of stretching that joint. Now the next one we're going to do, we're actually going to stretch it down. So like we're trying to pull the joint down this direction to kind of open up and stretch out that joint capsule. And this one's really easy. You'll just take your hands around the knee, and then you're just going to pull. I'm pulling the knee down so that I can get the joints to kind of stretch through there. So you'll feel it in the back too a little bit, but you're just trying to breathe as you're trying to pull this shoulder down, again, to just kind of stretch that joint capsule a little bit more. So these are 3 joint exercises. Hanging out again for a minute, do it a couple times every 2 to 3 hours, just kind of stretching this joint. And this will start opening up that joint a little bit more, because as we know, frozen shoulder can take years to get better. So we can do things to kind of speed up that process a little bit. Another thing that I want to mention before we get to the next 2 exercises, which are range of motion. One thing that most people don't have, most offices don't have, we have a machine called Shockwave. It's called Focus Shockwave. And it's something that can definitely speed up healing by like 50%, if not faster, when you have frozen shoulder, because you're getting, again, that joint capsule, you're getting adhesions around that joint capsule. It's called adhesive capsulitis. And the Shockwave can like actually knock out those adhesions really quickly to get people feeling better. So that's something to think about if you're looking at having frozen shoulder, to find someone that has radial Shockwave. Radial Shockwave does more soft tissue adhesions. They'll do degenerative tissues. They do tissues that have been scarred down. Works amazing for things like that. We've had people with rotator cuff tears, massive rotator cuff tears, that did amazing with radial Shockwave. So something to think about as you're listening to this video, like, ooh, wow, maybe I can find a place and I can try that. If you live in the Dallas-Fort Worth area, definitely check us out, because we can help you with that, because it does not take a lot of treatments for that. And then we can then get into some strengthening and continuing to improve your mobility as you start feeling a lot better, a lot faster. Okay, so that was a side note. Next one is going to be doing some range of motion. So I like to use like a rolly chair, where you can have your arms on the table relaxed, and you use the rolly chair to kind of move back and forth. So you'll just move forward, bring your head between your shoulders, your arms, and then you come back and do it this direction. So you can do that. Sometimes I'll have people put their hands on the wall and just walk and stretch and then come back up. So you kind of go to the point where you feel kind of like that stretchy pain, just getting the shoulder to kind of start moving. That's another exercise when we think of like just range of motion. And I would do, put yourself on a timer for a minute just to get it moving. And again, doing it every 2 to 3 hours. You can pick the ones that feel the best for you. You don't have to do all of these. You can pick like 3 of these to do. Because again, sometimes what works for one person doesn't quite work for the next person, but all of them eventually can get to all of these. And then the last one I'm going to show you for motion is rotation. So you want your arm, it's going to be 90 degrees, 90 shoulder, 90 elbow. You're just going to hang out something like this. And you're going to, again, slide the chair back as you move forward, and then come back up as you slide forward and backwards. Just come forward. Again, you can do things. You can come out a little bit farther. You can come in a little bit closer, come in closer. This makes it easier. This going out farther this way, that makes it harder. You can do the arms forward. Again, that's going to be a little bit easier. This is going to be a little bit harder as you move the hand forward and backward. They're all variations that you can do to start figuring out like, oh, wait, this is a better position for me. I actually can handle it if I move my arm forward and I come through here. Or I don't really feel it, so I'm going to move my arm backwards. I'm going to come out a little bit further away from the table and stretch that direction so that I can get more of a stretch. So they're all different variations that you can do. And again, I've just put yourself on a timer, do it for about a minute, and then again, every 2 to 3 hours. Now, if this is information that you've liked, we put out content all the time. We'll be doing other series of the shoulder to help you navigate how to treat that. So make sure you subscribe to our channel, like it. If you have any comments or questions, just comment below. Go into our description. We have a ton of resources there for you. And we'll see you next time.